this quite so hard it actually made me jump. I'm going to call to order the Dr. Cog Board of Directors meetings Wednesday, November 20th, 2013 at 6:32 p.m. And the first thing we're going to do is say the Pledge of Allegiance. May we have a roll call, please?
Eva Henry, Eric Hansen, Bill Holen.
Here.
Elise Jones. Here. Wayne Anderson. Tim Mock, Tom Hayden, Rocky Piro.
Here.
Chris Nevitt.
Here.
Jack Hilbert.
Here.
Connie McLean. Don Rozier.
Here.
Rachel Zenzinger.
Here.
Bob Roth.
Here.
Sue Horn.
Here.
David Spellman. Suzanne Jones. Here. Ann Justin. Cynthia Martinez. Lynn Baca. Paul Donahue. Clark Hamelman. Kathy Noon.
Here.
Ron Ingalls. Tom Riley. Doug Tisdale.
Here.
Gail Christie. Jim Benson.
Here.
Todd Riddle.
Here.
Mike Spees. Randy Penn.
Here.
Mark Gruber.
Here.
Joyce Thomas.
Here.
George Heath. Jennifer Weinberger. Lisa Jones. Bob Easton. Amy Shears. Henry Ergott. Paula Bovo. Dario Katarczyk. Bob Vermeulen. Marjorie Sloan. Ron Rakowski. Jerry Presley. Jack Morgan. Brad Weasley.
Here.
Adam Paul.
Here.
Phil Cernanek.
Here.
Jackie Millay.
Here.
Gabe Santos.
Here.
Hank Dalton. Susan Liu. Julie Van Domelen. Ursula Morgan.
Here.
Chris Wolf. Sean Foray. Joe Gearlock. Kevin Mueller. Joyce Downing. Carol Dodge. John Dyack. Cliff Muller. Fred Lissy. Kurt Osborne. Deborah Williams. Sandy Pennington. Val Vigel. Faith Winter.
No.
Joyce J. Doug Young. Deborah Perkins Smith.
Here.
Simon Tafoya. Bill Van Meter.
Here.
Okay, thank you. As this is our first meeting following the November election, we get to witness the elective process and the changes that come out of that. We have two new members. Suzanne Jones is not really new to us because she was our alternate from Boulder, but Casey Becker is no longer on the Boulder board, and so Suzanne Jones is our new member from Boulder. And Gabe Santos is our new member from Longmont. Have I missed any new members? Okay, we do have a group of people who are going to be leaving the board, either have left or are going to be leaving. I mentioned Casey Becker from Boulder. Sharon Richardson. Is Sharon here tonight? Okay, Sharon, thank you. I have to comment on Sharon in particular, but the next one as well, Jim Taylor, have been on this board for as long as I can remember. I want to thank you so much for your service to Dr. Cog. Jim Taylor isn't here. So Jim isn't here, but he's also been on Dr. Cog for as long as I can remember. Not that I've been here forever, but I don't know, it's like 8 or 10 years. So Katie Witt, is Katie here tonight? Alex Samory, Cliff Mueller, Cliff's here, right? You're leaving, Chris? Cliff's also been here for as long as I have.
I was hoping to introduce my
alternate or my replacement, but we haven't had that meeting yet. So we haven't switched our, so I'm still the guy.
He'll always be the guy.
Yeah.
And then last but not least, Nancy McNally, who's also been here as long as I have. I didn't see Nancy tonight, so Joyce.
She actually was, they actually had their meeting the following Monday from Election Day, so on the 11th, she was permanently out of office.
Okay. Well, another one who's contributed greatly to Dr. Cog, and with regret, we say goodbye to all of you. Did I miss anyone else who will be leaving? And then congratulations on elections and re-elections. Joyce J., who's the new mayor of Wheat Ridge. Phil Cernanek, who's the new mayor of Littleton. Kathy Noon, re-elected mayor of Centennial. And Rachel Zenzinger and Val Vigil, re-elected council members for Arvada and Thornton, respectively. Okay, did I miss anyone on the re-elections? All right, so that's just our bird's eye view. When we say that the membership of Dr. Cog changes significantly, this is an opportunity to see what kind of things happen, and then we'll have a follow-up in April for all those elections that are in April. Next on the agenda is a motion to approve the agenda.
Move to approve.
Second.
It's been moved and seconded that we approve the agenda as submitted. All those in favor, please signify by saying aye.
Aye.
Aye. Opposed? Abstentions? The agenda is approved as submitted. Next is report of the chair, and I have three things this evening. You will find in front of you a little one-page ad, I guess, for our semi-annual awards. We will be giving in 2014, and we did in 2012. Really? Okay. Sorry, had a little note here. But as I'm corrected here, annually we do these awards, and they include the Local Government Awards, the John V. Christensen Memorial Award, and Way to Go Commuter Champion Awards. Tells you on here that the time to submit nominations is open now. It's going to run through 4 p.m. Friday, January 31st. I would encourage everyone to think about this and submit someone that you think might be worthy of one of these awards. These are very nice honors. And then I just want to report to you, we have on our agenda this evening an item to elect or select 2 people for the nominating committee for Dr. Cog officers for next year. The admin committee selected 2 people. 2 of those, that nominating committee is made up of 2 people from the admin committee, 2 people from the board, and 2 people nominated by the chair. The admin committee selected Chris Nevitt and Adam Paul, so those are our first 2 members. And later on today we'll be adding 2 from the board. Okay, that's the or no, the board is going to add to those members. All right, so at this point I'll turn it over to the executive. Oh, sorry, I have a note here that I did miss someone. That Denny is also no longer with us from Broomfield. So he's been on the board as long as I can remember too. So another person who's really contributed to the board, and we thank him for his service. With that, I will turn the mic over to Jennifer for the report of the executive director.
Kind of a big loss.
Thank you, Madam Chair. I just have 2 things I'd like to talk to you about tonight. One is I want to introduce you to the 2 newest members of the Dr. Cog Senior Management Team. One is Jerry Stiegel. Jerry, you want to stand up for just a moment? Jerry is the new Director of Organizational Development. The board will recall back in September I talked about doing an exercise where we look at mission vision, where we look at governance and structure, where we look at strategic objectives. Jerry is going to be leading that role here, Dr. Cog, and in fact he had the first meeting with 13 of you earlier this afternoon, and I think those that were in attendance had really good things to say about the exercise that we went through. And there'll be lots more of this going on, and lots more opportunity for board participation in these smaller groups that we're doing to complete this exercise. The other member of the senior management team is Doug Rex. There's Doug. Doug comes to us from Oklahoma City and is the new Director of Transportation Planning and Operations. I won't say he's the new Steve Rudy, but that is the position that he has now. We're very excited to have Doug join us. He's been at Oklahoma City for quite some time. He's done some great innovative things for the MPO there, and he's going to be a great asset for DRCOG. So thank you, gentlemen, for coming this evening and being introduced to the board. Sure we'll be seeing a lot of them. The only other thing that I wanted to report was Jayla Sanchez-Warren, who's the director of the AAA, and I were accompanied by our lobbyist to a trip to D.C. the last week of October. The purpose of our visit was to talk with members of Congress about the reauthorization of the Older Americans Act. This was kind of a different visit than we've done in the past. We actually went with other AAA directors, those from states that were hard hit by the sequester, like Colorado. While we were there, we actually attended the committee, the Senate committee that the Older Americans Act started out in. That's the HELP committee, and Senator Bennett from Colorado is a member of that committee, and he actually voted for the bill that day. The problem is that Colorado is the nation's biggest loser under not only the current bill, but the proposed bill that's going to be reauthorized, and that's because of funding formulas that are in that bill. The bill that's being proposed and was passed by the Senate committee has a 5-year lifespan, and knowing Congress the way we do, we can anticipate 1 to 3 years probably of continuing resolutions before another bill is passed. So the last thing Colorado wants to see is a 5-year bill that probably has an 8-year life extended for that period of time. The real issue is that because of these old funding formulas that use old census data, even though there has been a 2010 census, these bills look at the senior population at the year of 2006. The way the sequester is being implemented, they use these old funding formulas as well. So not only do we lose out on the front end because the population numbers are incorrect, we're not getting credit for all of the senior growth that we've had here in the state. The sequester comes in and uses those same formulas, and we get cut more than other states do. And in fact, in some program areas, in the first sequester, we were cut more than 15%. That is a huge cut for us. And DRCOG AAA being the largest AAA in the state, we suffer the greatest in that cut. We were fortunate this year for two things. One is the General Assembly put some additional money into the Older Coloradans Act, which helped, I won't say backfill, but that's essentially what happened where the sequester had cut us. But the other thing that happened with this first sequester was Congress found money. I don't know where they found it, but they say they found money to pay for some of the cuts, so we didn't feel the full impact of the first sequester. As part of the budget deal, the next sequester will happen on January 2nd. The DRCOG AAA is unfortunately planning for a 22% cut in services. That is huge for us, and for those of you who may not be that familiar with the AAA, it's a very parallel universe with transportation planning. There is far more need for money than there is money to put out into the community. So Jayla and I have been having a lot of discussions, and Jayla's been trying to have some discussions with the state as well to try to figure out how are we going to deal with this. We, as I said, Senator Bennett and the Help Committee actually voted for this new authorization, which keeps these old funding formulas which hurt the state. We have talked with his office since, and it's our understanding that the senator voted for the bill, understanding that this would be the only way that he wouldn't adversely impact his relationship with the chair of the committee, and would still have the opportunity to work with committee members on fixing these formulas and using current data. We're keeping an eye on it. I honestly don't anticipate Congress will do anything. In fact, if you put holidays and the normal work week for Congress on a calendar, they basically have about 3 weeks left before the end of the year. So I fully anticipate sequester, the full force of the sequester will be implemented on January 2nd. And while it's possible that Congress will come back after the 2nd and say, okay, we found some more pay for us so we don't have to implement the full cut, we have to be prepared, and so do our contractors have to be prepared to take that big cut. The other problem for all of us that are impacted by sequester is that, as I said, it takes place on January 2nd. That's the middle of the federal fiscal year. So we're not having to spread 22% over a 12 months period. We're having to spread it over 6 months if we're lucky, and quite frankly, between what Congress does and what the administration implements, it's more likely we'll only have 3 months to implement this 22% cut. So that's something else that we're making Senator Bennett's office aware of, that if nothing else, if we're going to have to live with sequester, fine, we don't like it, but at least make sequester and the federal budget year coincide, because this is really, really tough. We have more than 30 contractors out there providing services. They've spent 6 months of funding already, and now to come back and tell them, oh, by the way, we're taking back 22% of what you had anticipated spending, that's going to be an issue. So as I said, we took some other AAA directors with us. North Carolina in particular, they were the second hardest hit in the nation. And then an MPO from Maryland also accompanied us. They weren't quite as hard hit. The really distressing thing about this too is that the national associations have basically convinced the AAAs across the country that a bad bill is better than no bill at all. That if we have years, 2 or 3 or 4 or 5 years of continuing resolutions, eventually Congress is just going to say, okay, we're just going to get rid of this program. In the research that I've done, I can only find one instance where Congress eliminated a program that had been in this continuing resolution situation, but even that program was funded by continuing resolutions for over 9 years before Congress decided to cut it. So our position is, let's try to get a good bill, a fair bill, one that treats seniors in every state the same, rather than saying that seniors are are more valued and get more money in a state like Iowa, who didn't see any cut in some of their program areas, as opposed to giving Colorado seniors less money per senior and cutting us even more at the time of sequester. So I'll keep you apprised of what's going on with that, but between now and January 2nd, I don't expect Congress to fix anything for us. So unless you have any questions, that concludes my report.
Madam Chair.
Yes.
I think the other issue, Jennifer, is the fact that we're moving into an election year and nothing's going to happen then. And could you probably put together, or have your staff put together the impact in a memo for us, so we can look at when we meet with the delegation officials? We'll have that ready to be able to argue.
Yeah, we'd be happy to. And in fact, by taking North Carolina along with us, we were able to meet with Senator Burr, who had an amendment in the HELP committee to eliminate these formulas and start using 2010 data to level the playing field and to make sure that seniors in every state got the same amount of money. And that amendment was defeated by, I think, 7 to 12 or 14. I'm not sure the exact vote. But he made a very impassioned argument. He actually used Colorado as the example of the state being hardest hit, and he actually used Iowa as the state least hardest hit. The senator from Iowa, who is chair, is Senator Harkin. So he knew probably that his amendment would not pass. But it caused sufficient conversation for Senator Harkin to promise to put together a group of the committee to take another look at the formulas and decide what to do next. So Jayla and I are more than happy to put this together. It'll take like 5 minutes. It's cut and pasting a couple of other documents, so we're happy to do that.
Because I could probably at least get some of the elected officials to send letters and indicate the impact. I think it's more appropriate when you begin to look, when you're able to use classic and real examples of what this impact is going to have, and it's much more effective in lobbying for these issues.
Right. Well, and honestly, it's very short-sighted of Congress not to understand that when you take away rides from someone who needs to go to dialysis 3 or 4 times a week, you are going to force them into a facility and into Medicare and Medicaid at a cost 100-fold of what it costs for us to provide a ride or a meal or whatever the case may be. But yeah, we'll happy to put that together for you, and we'll get that out to all the board members. So please share it with all the members of the delegation that you run into. Thank you.
Okay, do we have any more questions for Jennifer? All right, it's now time for public comment. We've allocated time for the public to comment, and each speaker will be limited to 3 minutes. If there are additional requests from the public to address the board, time will be, we'll cut that off at 45 minutes, although it may not take that long. But if it goes over, that time will be allocated at the end of the meeting to complete public comment. The chair requests that there be no public comment on issues for which a prior public hearing has been held before this board, and consent and action items will begin immediately after the last speaker. I would ask that each speaker step up to the podium, state your name for the board, and then make your comments, and then Connie will let you know when your 3 minutes are nearing.
Hi, board. My name is Louis Apolinar, and I'm a worker on strike against a company called Rocky Mountain Reinforcement. I spoke to the board last May about these issues, and I am here to remind you of the problems with this company. As a worker of RMR, I have experienced cut in pay on the Union Station job. It's a federally funded job, and they cut my prevailing wage down by $8. And also, since I have spoke with you, the Department of Labor found more prevailing wage violations with Rocky Mountain Reinforcement on RTD projects. Rocky Mountain Reinforcement has broken federal prevailing wage laws on numerous occasions since 2010. We are hoping you can pass the message to RTD and ask them to implement stronger standards for companies on their construction projects. Thank you.
Thank you. Did we have anyone else who wished to speak this evening? Okay, then we'll move into the next item on the agenda, which is the consent agenda. This evening it includes the minutes from September 18, 2013, a resolution regarding a recommendation to the Governor's Energy Office about the compressed natural gas project, the approval of the 2014 Dr. Cog budget, the approval of a committee to work on organizational development issues for Phase 1, which is mission, vision, and commitments, and the approval of the proposed urban center amendments for modeling purposes. If there's nothing you want to remove from the consent agenda, I'm in need of a motion to approve it.
Second.
It's been moved and seconded that we approve the consent agenda as submitted. All those in favor, please signify by saying aye.
Aye.
Opposed? Abstentions? The consent agenda has been unanimously approved. Next on the agenda is the move to adopt a policy for telephonic participation during meetings of the Dr. Cog Board of Directors and amend the Articles of Association accordingly. You may recall what we have not in the past had that opportunity. We did implement it a year or so ago for the admin committee, and this is an opportunity to do the same for the actual board, the full board, and I will turn it over to Jennifer to talk with us about it.
I don't really have a whole lot more to add to that. This is a policy that the administrative committee already has. I think probably maybe the only exception here is that as far as differences in their policy and the board policy is that they can hold a telephonic meeting if there is business that is pressing and necessary, but there is no board meeting scheduled for that evening. But this, your attorney hates these kinds of things, mostly because he knows how important it is for the public to have the opportunity to get in front of you, to be able to speak to you, to see who is speaking, that sort of thing. But on the resolution, the pink page that's in your, it's actually the first page after the agenda summary. Item A at the bottom of that where it says statement of policy. Item A talks about the times when telephonic participation in a board meeting is approved. That would be emergencies related to accident or illness. When vacations are scheduled well in advance of meetings and you know that you're not going to be around, last minute familial obligations or weather conditions, particularly like some that we've had recently here in Colorado, be they snows or floods or that sort of thing. So the other item that's in here, the last page of this item, is the actual red line version of the changes to the articles. And this, being a change to the articles, requires a certain number of board members to be present. Are we all, or do we have 29 here? Okay, so again, unless you have questions, I'll turn it back over to the chair. Deborah.
Yes, Deborah?
So when there's a supermajority vote required, I don't see anything in here actually allowing or preventing the telephonic participant part of the supermajority. So in other words, do we want that, or do we feel that they should be present when we're having a supermajority vote requirement?
Well, I think, and correct me if I'm wrong, I think in this particular proposal, if in fact we pass the option of telephonic participation, then they would have full voting rights, and so they would be a voter if we were considering a issue that required a supermajority.
If I could add to that too, we would have to do a roll call vote on a
Right.
supermajority vote to be sure that we had the 29 present and voting.
So I kind of feel that when there's an issue that's that important that needs a supermajority vote, that it should be, you should be here in person. So I would like to see that stipulation put into the policy.
The stipulation being that you be present for that
Correct.
type of vote.
It would not count towards a supermajority if you were on
Oh, it would, okay.
on the telephone. If you're not present, it would not count.
My only concern about doing something like that would be, let's say it is an adverse weather event, and we, for whatever reasons, we have no more time, we can't defer something like adopting amendments into the plan without being out of fiscal constraint or something like that. That could be problematic. I mean, being out of fiscal constraint for a month, probably not that big of a deal, but it is something that we should consider.
And we could certainly put in extreme circumstances, but I think being present and understanding and visualizing someone's mannerisms and discussion and being on the phone, it's a whole different way of voting. I mean, you don't get the same effect. So that's my concern.
Thank you. Ursula?
Yeah, I have some concerns with everything with the exception of travel for hazardous conditions. If you have an illness, a vacation, what else is there here? Family obligations, that's what your alternate's for. And they need to be here. If the town is cut off, like Netherland or Lyons, you can't get here, I get it, and we should. And even on supermajority, because they may be cut off for more than, a month. So I really think we should look at the reasons to participate. I'm only really comfortable with weather conditions, and that also means, washout roads, floods, making travel hazardous to meetings. Otherwise, that's what we have alternates for. And if your alternate can't make it, then you're SOL. Or you have to call ahead of time to Connie and say, our new alternate is. Because there is time to have a new alternate put in place if you know you're going to have a family obligation or a vacation. So I really have concerns with that.
Okay, do we have other comments on it? Doug?
I would agree with the potential limitation to the opportunity to participate telephonically being weather-related or other extreme circumstance, and sometimes it's hard to define or describe that, because DSA, the fact that the rain had stopped but Lyons was still cut off, is that in fact a weather condition? I think it is a weather condition, or at least it's an extreme condition. I think long-standing family obligations or vacations and stuff, that Ursula is right, that Trustee Mead is right, that it's an inappropriate opportunity to participate telephonically when you should have your alternate. But I would submit that if there is such a circumstance where it is a true emergency or it's impossible to get to the meeting, that it would be, given that it's a relatively exceptional circumstance, it would be appropriate, even if a supermajority vote is required, to have that person be allowed to participate in that case. There's also a provision that if there is abuse of the policy, the board may, in fact, revoke a person's right to participate telephonically because there is an apparent abuse. But I could see modification to the exceptions in Section 2, subsection A, relative to what circumstances allow, but I would consider allowing it for supermajority vote.
Thank you. And honestly, I think I agree with that. I think it's really, there's a reason why our attorney doesn't like this. And I think one of the things is that we could quickly deteriorate it into a whole lot of people deciding they'll just participate by telephone. I don't, though, want to get into trying to wordsmith changes because I think they might end up being somewhat extensive. So if the majority of the group believes that we ought to look at these changes and limit much more the ability to participate telephonically, then I'd like to recommend that we pull this and bring it back at the next meeting. There's no urgency to it, but I don't want to do that and implement this change if everyone else is quiet because they think it's wonderful. So so I can do by nod, are you thinking we ought to do some more work on it and limit it more? Commissioner Hilbert?
Yeah, I would make a motion that we send this back to staff and direct them to consider the points that were made here by the board members today and to come back at another time with another draft to see if it's something we should consider at that point.
I second the motion to table.
Pardon? I second the motion to table. Okay, thank you.
Okay, so we've had, it's been moved and seconded that we table this, bring it back with the changes suggested. Any more discussion?
Do we need a date certain?
We'll take this back to, or we can get this back to the attorney this week and let him know what the concerns are, and just hope that it doesn't snow in December.
Okay.
Since we definitely have stuff to bring you in December, it will be a meeting.
Okay. So I think we won't put a specific date in as soon as possible, hopefully the next meeting, unless we have some sort of issue with the next meeting. Mark?
Thank you. Could you also look into enhancing the technology and perhaps using Skype? We could put as many as 12 people on these screens if we had to. Hopefully that wouldn't happen, and it would be unfortunate if you had one big head talking to us on the screen, but we did address, there was an address earlier to the impact of body language, and if we could see the person under discussion, it would be helpful.
And
So, if
no
you can look
attending
into
in
the
your
technology,
pajamas either.
That'd be great.
We'll look into it.
So, yeah, absolutely, I think we can look into that. I do want to caution you that there could be children's faces, animals, any other number of participants should we do that. And is it Rocky?
Yeah. So quickly, I was going to offer something similar that I think the overall experience would be enhanced too if the participant was able to access what we're seeing visually and so on at a meeting. So it's a little challenging if they're just on a phone, but they're not seeing the presentation and so on. So again, I don't know if we have that capacity yet to do that, but I would say, you know, in some of our discussion of telephonic, we were understanding it's more than just audio. It's the capacity to interact electronically.
So I appreciate those suggestions. Those will involve some additional costs. So we may have to implement this in phases. We may have to implement telephonically initially and then explore the possibilities to expand that, but we'll include that in our further analysis. Commissioner Holland?
Yeah, I would just add that, you know, I think telephonic conferences tend to limit the ability to access the information, and I think the quality of the vote and the decision of someone on the phone is, I think, less studied.
Thank you. And I think for that reason, as you've heard here, our attorney would be very opposed to telephonic conferences as a norm. Rather, the exception would allow someone to join us. So we'll pull this. Oh, I'm sorry. We have a vote. We have a motion on the table. If there's no more discussion, I'll call the vote on this. All those in favor, please signify by saying aye.
Aye.
Opposed? We have Adam. And abstentions? All right, thank you very much. The motion is passed, and we will refer this item back to our attorney and bring a new one forward to you as soon as possible. Next on the agenda is a move to appoint 2 members to the nominating committee. Again, I mentioned before, the nominating committee is composed of 6 people, 2 of whom are appointed by the admin committee, 2 of whom are appointed by the board, and 2 of whom are appointed by the chair. That would be me. And so I'll turn this over to Executive Director Shuffle to give us more information on the qualifications and how this process works.
Okay, so tonight at the admin committee meeting, the administrative committee nominated their two individuals for service on this committee. Chris Nevitt and Adam Paul were their nominees. I should tell you before you make yours that Ron Rakowski, Mayor of Greenwood Village, has expressed interest in serving on the nominating committee, although he could not be here this evening. As Sue has already described, this committee needs to make 2 appointments to the nominating committee, and Sue will make 2 more, and then that group will get together and look over the letters of interest provided by those of you that have said you'd like to be considered to serve as an officer. And then at the January meeting, the nominating committee will submit to the board its nominees, both to to join the officer slate, as well as making some appointments to the administrative committee. And those folks will be elected at the, or elections will be held at the February meeting of the board. So I'll turn it back over to the chair for you to make your 2 nominations to the nominating committee.
Chris?
Why do I always get the bum mic?
I was just going to say, it didn't start out as a bum mic. It's something.
It worked for Hilbert. I wanted to nominate Suzanne Jones to be on the nominating committee, if she's willing to endure that kind of unpleasantness.
Keeping in mind that Chris is serving.
Okay. So Suzanne Jones, and I'm sorry, in the back. Thank you, Bob.
Yeah, I'd like to nominate Mayor Rakowski.
Okay, so we have Ron Rakowski and Suzanne Jones. Don?
Thank you, Madam Chair. I'd like to nominate John Dyack from Parker.
Okay, any other nominations? Any other volunteers? I say that because for my 2 appointments, I would really like to appoint people who are interested in serving on the nominating committee, as opposed to just saying, okay, it'll be you, or whatever.
So how many do we have now?
So we have 3 nominations and 2 from the admin committee. We have 1 more position, even if. Right. Well, that was sort of my hope.
Kathy.
And Kathy, are you volunteering? Okay, thank you very much. I was just going to say, is there someone not here this evening that we could volunteer? All right, do we have any other volunteers or people who would like to be considered for this position? So I have a technical question. If there are no other ones, do we have to have a vote?
We do.
Okay. So we have 4 people who have volunteered. We're going to have a vote to see who this board appoints, and then we'll determine who the chair's going to appoint.
Madam Chair, point of order.
Yes, ma'am. Or, sir. Sorry. And that's a deep voice. How could I possibly?
See, I actually thought you said yes, Mayor. So I was.
Yeah, she did say that.
I was okay with that. I was just going to suggest a possibility that if the chair wanted to indicate an inclination to appoint the other 2, whomever the board might appoint, we could save the necessity of filling out ballots and returning them for counting.
So that's why I asked that question. Do we have to vote? Because I'm going to appoint the other 2. And so if that's the case, could we just
If the
say
chair
the
were
vote?
to appoint 2 in the first instance, then the 2 remaining could be named by acclamation.
Okay, who are the first 2 people on the list? The chair will appoint Ron Rakowski and Suzanne Jones. So those remaining for you to vote
Move
on.
that John Dyack and Kathy Noon be elected by acclamation.
Okay, it's been moved and seconded that we elect John and Kathy by acclamation. Any discussion? All those in favor, please signify by saying aye. Aye. Opposed? Abstention? All right, we have our so our 6 members of the negotiating committee, nominating committee, nominating committee, Chris Nevitt, Adam Paul, Ron Rakowski, Suzanne Jones, John Dyack, and Kathy Noon. All right. Thank you very much. Next, we move into 3 items that were discussed by MVIC and then move forward to our meeting here this evening. I'm hoping everybody's had the time to take a look at the associated attachments, which are attachment J, K, and L. These are recommendations from the MVIC committee. We do have Steve Cook here to answer any questions that you might have on the specifics of these. And then if we've answered the questions and or you don't have any questions, I'll be looking for motions. The first item, the next one on the agenda, is a motion to approve ramp-funded projects to include in the air quality conformity modeling for the Cycle 2 2013 amendments to the fiscally constrained 2035 Regional Transportation Plan. Now, these are the ramp projects that have been approved by CDOT. In order for us to be in fiscal compliance, we're going to need to include those in our plan. So that's what this is about. Any questions for Steve? Motion?
Second.
Thank you. Okay, it's been moved and seconded that we approve the ramp-funded projects to include in the air quality conformity modeling for the Cycle 2 2013 amendments to the fiscally constrained 2035 Regional Transportation Plan. Any discussion on that? All right, all those in favor, please signify by saying aye. Aye. Opposed? Abstentions? That motion's been passed unanimously. Next on the agenda is a motion to approve all proposed projects shown in Table 1 in air quality conformity modeling for the Cycle 2 2013 amendments to the 2035 fiscally constrained Regional Transportation Plan.
So moved.
Okay. It's been moved and seconded that we approve that motion as I just read it. Are there any discussion or questions for Steve on this one? Elise?
So not a question for Steve per se, but I did want to flag for the board's attention the discussion that came up in MVIC about not this vote, but the idea of directing staff to bring forward information on whether or not the board should consider in the future a policy about having HOV, an HOV component to all managed lane projects. And I don't know if Jennifer, you wanted to talk about that briefly, just so that folks on the full board knew about that. I could, but this.
What I'll do is refer you to attachment O, page 2 of the summary MetroVision Issues Committee meeting. The very first motion on page 2 of that document is kind of a summary of where this was discussed. Elise raised the issue as to whether or not DRCOG should adopt some sort of general policy regarding managed lanes, and that created a discussion about would C470 be included in that. Actually, there was a lot of discussion that's, again, these are summary minutes, so there was a lot of discussion around that idea. But what was finally decided was that we didn't want to even talk about a policy per se yet, but that staff would put together information and some policy options about managed lanes to be considered later on. If you go back and listen to the actual discussion, it was suggested that that information and those policy options go to MVIC, but that not really be part of the discussion about Cycle 2 amendments, period. So I would expect that sometime well, probably sooner than later, staff will start kind of gathering some information and helping understand the differences in the types of facilities, not only here in Colorado but around the nation, and bring you some information about how these things work and how projects are priced. I know that C470 in particular, there was a lot of discussion about C470 and how their pricing model would be impacted by HOV. So again, the staff direction was pretty clear, and it's listed there about 3/4 of the way down the page that staff would bring back information for MVIC to take a look at to see whether or not the board would want to put together a general policy for toll facilities going forward. And I'll turn it back to you, Elise, if you want to add.
No, thank you, Jennifer. I just didn't want the board to wonder if MVIC forwarded to them some policy options on this idea, where the heck it came from. So I just wanted to flag for the full board's attention. It came out of that discussion during this agenda item, and depending on the information that's brought to MVIC, we may be voting on something and bringing it to your attention.
Thank you, Val.
Thank you, Madam Chair. I just wanted to highlight for the board on table 1 under the RTD, the first item on there, the extension of the north line from 72nd to 124th.
We hadn't noticed, Val.
Commissioner Hilbert.
Thank you. And just very quickly, I would like to let for those in the north know that Mayor Gunning from Lone Tree and Commissioner Hilbert went down to RTD and testified on behalf of their wonderful decision to put that forward. So thank you.
Okay, do we have any other discussion? If not, we have a motion on the table to approve the proposed projects. All those in favor, please signify by saying aye. Aye. Opposed? Abstentions? The motion passes unanimously. Our next motion is a motion to approve the MetroVision Issues Committee recommendations on the 2016-2021 Transportation Improvement Plan. This is in attachment L, and these are some of the preliminary former rules that we included in the TIP process. So if you have any questions, again, Steve Cook is here to answer those questions. Okay, we have Rachel and then Gabe.
I do not have a question. I was going to make a motion, so I'll defer.
Okay. Gabe?
Thank you, Madam Chair. I have a question, and this comes from staff and actually Councilmember Witt. How is this method different than, how's this method of developing the TIP policy different from the previous TIPs? And why is it different and why?
Sure.
Actually, it's not that different. For the 2007-12 TIP, 2008-13 TIP, and the 2012-17 TIP, MVIC has been either lead or co-lead on TIP policy. This is not anything out of the ordinary, and in fact, the board always decides where the TIP is going to be initiated. This is the way it is right now. That's not to say that it couldn't change at some point, but the policy right now, or the historic guidance is that the board decides where TIP will be started. So MVIC has recommended that they are the appropriate body. As I said, they've done this 3 times in recent TIPs. And the other thing that MVIC is recommending to you is that items of a technical nature go to the TAC. So I wouldn't say that it's that different. The board has put together TIP criteria in a number of ways. In the 9.5 years that I've been here, there have been, like I said, a policy work group comprised of TAC members, board members, and other outside interest groups, along with MVIC. MVIC took the entire lead at one point. There have been ad hoc and technical work committees that have done this. It's been done any number of ways, and because I suggested back in February at the board workshop, and I've been talking to the board intermittently since that time about simplifying the tip, looking it over, trying to find ways to make it understandable to all board members. In fact, Commissioner Hilbert at a recent meeting read some language, I think that was maybe at an MVIC meeting, read some very confusing language right out of the tip to help decide on a particular criteria option. And my goal is to create a tip that would allow you as elected officials to go back and talk with your constituents and help them understand why you didn't or why you were unable to bring money back. Sure. That's been my goal, and that's what I've been talking to you about, and this is that initial step.
Okay. Well, and being new to the board, so I guess what city staff indicated is that some of the technical staff are no longer included in some of the policy, I guess, discussions. So they were just kind of confused about how now they're, I guess, sitting on the outside.
Well, I'll be honest, I've heard this from other technical staff. This is not the first time that this has come up, and this has never been the intent. But MVIC is your policy board, and so it's been my intent, the Dr. Cog staff intent, that policy decisions come to elected officials. Elected officials set policy. Technical staff tell you how to accomplish that. And in fact, MVIC at their last meeting identified a number of areas that they wanted the TAC and even subject area experts to weigh in to help us come up with some better ways to measure criteria. It's unfortunate that technical staff are feeling somehow left out, but this is not something new.
Okay. Well, I appreciate the clarification. Thank you.
You're welcome. Thank you.
And just a clarification, and then we'll go to Rachel. This recommendation is for the Metro Vision Issues Committee to take the lead. It's in the policy-making piece, and I think we've discussed as far back as our last workshop that it was important for the elected officials to be responsible for the implementation of the policy. Then the technical pieces, we have a number of advisory boards, the TAC is one, that advises us on the technical piece of how one might implement that or what the technical implications might be of a specific policy. So we might go out to a technical group and say we're weighing a couple of approaches to the policy. Give us some feedback on that, what that might do to you technically. So I think those groups would still work together, but oh look, we're getting entertainment.
Hey, don't ask me how it happened.
Or, more importantly, how to turn it off.
Yeah, thank you. Is there a teenager in the house?
A little levity. So I think there still is that intention when we need some technical advice on that to go out to the various committees that might give us that. But the ultimate policy making will be initiated by MVIC, but as always the board will have a final approval on that and could make changes. So that's what we have here. Rachel?
I wanted to move to accept the motion, and I also wanted to speak to it. I'll wait for a second and then I will. I just wanted to compliment the members of MVIC who participated in this conversation, and if you were not present, whomever your alternate or your MVIC member who did participate in the conversation, I thought it was a very productive work session, and I really felt like we had a diversity of opinion, but in the end we were able to, I think, put forward a pretty good set of recommendations, and I was really pleased with how the conversation went, and the fact that so many different perspectives at the end of the meeting felt like they were heard. So I think that is a good indicator that it was a healthy discussion, and I'm very happy to be able to move acceptance.
Thank you. Do we have further discussion on the motion? All right. It's been moved and seconded that we accept the motion. All those in favor, please signify by saying aye.
Aye.
Opposed? Abstentions? The motion passes unanimously. We're now moving into committee reports. The report on the stack from Beth Humanek.
Thank you, Madam Chair. I was unable to attend the meeting last week because I had severe laryngitis, and I believe Jim was at the National League of Cities conference, which is where I would have been had I not been ill. So I am deferring to Steve Cook, who was able to attend, to give the update tonight. Thank you.
Okay, thank you. So the State Transportation Advisory Committee meeting was held last Friday on November 15th. The first item that they discussed was MPAC 64, where Mayor Gunning gave a presentation on that, and there was a good discussion on MPAC 64. They also discussed MAP 21 and how some of the rules, draft rules, will be released in the coming months for public comment, and staff is gearing up to review those documents from the feds related to the rules associated with MAP 21. They did note that it's going to be at least another year into 2015 before USDOT actually finalizes the rules, and then of course that will be after we adopt the new 2040 plan and the new TIP. So it'll be a while before some of those things kick in. I think some of the transit things actually kick in next year. Results of an internal audit of CDOT's Faster Safety Funding Program were presented. These projects have been selected and funded by CDOT, I believe starting in fiscal year 2011, I think was the first year of that. The audit was conducted by CDOT to report to the legislature on how the program is doing. 3 key items were noted which CDOT should improve upon. They need to define clear and specific metrics of safety benefits when selecting projects, more timely reporting of results of projects with standardized metrics, and they need to improve the overall project selection process. The next action item that the stack addressed was the fiscal year 2015 budget for CDOT. It was noted that there are virtually $0 for additional roadway capacity in that budget, and the stack did recommend the budget to the Transportation Commission, which will act on it tomorrow. And finally, CDOT presented their recommendations for program distribution of funds. Now, program distribution is a very important process because that helps to determine the amount of funds that we can expect in the long-range 2040 regional transportation plan that we're working on. STAC approved the allocations in the CDOT's regional priority program, so those were approved, but with the condition that the allocation formulas for that be revisited if the funding in that program increases significantly. Dr. Cogg's staff, me, noted that the current formula does not provide an equitable share of funds to CDOT Region 1, which essentially is a lot of the Dr. Cog region. The allocation formula would only give 31.7% of the funds of this one little pot of funds to CDOT Region 1, whereas it's 50% of the population, so we raised issues there. And a Transportation Commission workshop was held earlier today, and they'll be having discussions tomorrow. The STAC tabled the action on the CMAQ funding allocations until next month so they could have more discussion. So with that, if there's any questions on the STAC meeting.
Thank you, Steve. Did we have a question? I'm sorry.
Really wasn't a question. Just when was the last time our acronym list was updated? Because I think we ought to add MAP 21 and RAMP. Of course, I know what they stand for, but there are a lot of other people that might be.
We'll take care of that.
Good idea. Yeah.
One more thing for Doug Rex to remember.
Just to clarify for the minutes, Steve, I wanted to say that the executive director actually asked for that audit. It wasn't the state legislature. So for the faster audit, it was requested by the executive director. If the minutes could reflect that. And then also, there were 2 other program distribution elements that were approved by the STAC that went to commission today, and that was let's see, it was for the transportation planning, and that was to keep the same formula you currently have, and then also for STP Metro to keep your current formula. And as part of that, something like STP Metro, you get 78%, I think. So just to reflect that in some other categories, you get a lot of money. So,
Thank you, Deborah. Okay, if there's nothing else, next we'll have a report from the Metro Mayor's Caucus. Mayor Tisdale.
Thank you very much, Madam Chair. Metro Mayor's Caucus met on October the 2nd of 2013. We had a presentation by Dan Ritchie relative to investing in science, technology, engineering, and mathematics, and he has actually funded the Daniel Felix Ritchie School of Engineering and Computer Science at DU. He also spoke about stem cell research, particularly some groundbreaking research regarding adult pluripotent stem cells and the tremendous advances being made there using adult stem cells. And he spoke also about the constitutional reform in Colorado and the institute that is currently housed up in Keystone, I believe, to begin the process of addressing the massive reworking of the Constitution that at some point in time will be indicated in Colorado. Our next topic was the Colorado flood recovery, and we had some significant presentations. We all applauded Julie in Lyons and what she had to put up with and live through there, and thanked Mayor Noon for her participation in providing support to a lot of the people there by providing cardboard boxes, a much needed item when you have floods. And then we had reports from Boulder and Aurora and Erie and Nederland, and Mayor Gerlach commented, and I had some pictures relative to that, and then other cities that were impacted by the flood. Needless to say, a lot of our discussion was focused on the floods because it was a very, very recent and tragic event for all of us to deal with, or catastrophic event, not tragic. Transportation updates were provided by the peripatetic Mayor Gunning, who once again spoke about MPAC 64 and the efforts that Metro Mayor's Caucus is working on with the CDOT representatives, and particularly with Executive Director Don Hunt, along with others in the state relative to the possibility of going to the voters with a ballot question in 2004. Much of that is going to be probably determined by some polling that is ongoing as of this point in time as to what we call the straw man proposal concerning how much of a tax increase and targeting projects and so forth. And we hope to have information on that available at the January Metro Mayor's Caucus meeting. And there was also an update by Mayor Bob Murphy of Lakewood concerning construction defects. And we all put anchovies in our mouth in order to bait our breath relative to the Dr. Cog report, which followed soon after that.
And I would just add, although I could have missed it when I was trying to figure out what peripatetic meant, the Metro Mayor's Caucus will have a special meeting on December 18th to primarily get an update on transportation and the ever important polling that should be concluded by that point in time, which really will largely constitute where Impact 64 goes from there. Thank you, Mayor Tisdale. And now a report from the Metro Area County Commissioners. Commissioner Rozier.
Thank you, Madam Chair. I don't know how to follow up, Mayor Tisdale. Yeah, whatever. I don't ask me to spell that word, please. I'm an engineer, and we're terrible with that. I'm gonna be short and to the point. We're having our MAC and MMC annual legislative reception. Excuse me. It got me all choked up. The reception is tomorrow night, 5:30. What was that, Connie? It's all those anchovies, bated breath. It'll be tomorrow night at 5:30, from 5:30 to 7:30 across the street at the Denver Art Museum. Hope to see many of you there.
Thank you. Next is our report on the Advisory Committee on Aging. Jayla Sanchez-Warren.
So the Advisory Committee on Aging heard about one of our newest programs, the Elder Refugee Program. This is a program that we partnered with the Colorado Refugee Services Program, also known as CRISP. The goal of the program is to decrease isolation, improve health, and reduce expensive medical care costs for elder refugees. There are about 2,000 elder refugees in our area, placed here by the United Nations, here legally, accepted by the United States, fleeing from countries because of political or religious persecution. A lot of those folks are really isolated. And you know, and many of these people have a lot of prestige being an elder in their country, and when they come here, they tend to lose that prestige. And their families go off and try and work and earn money, and they're very isolated. And so oftentimes the time that they seek medical care is in the emergency room, and they end up in the hospital costing the most money. And so this program is really designed to help reduce those costs and improve the health care of our older refugees. We talked a lot about sequestration 2014, and as Jennifer described, it does have significant impacts. And as a result, I had to do some scenario planning. It will dramatically affect the services in the region. We're estimating about 45,000 meals will not be able to be delivered in the Congregate and the Meals on Wheels program. About 25,000 rides to dialysis and to medical programs. It will also impact service providers in your area. Seniors Resource Center in Jefferson County serves Jefferson County, Gilpin County serves the whole region, but a lot in Jefferson, Gilpin, and Clear Creek will be dramatically impacted. Their dollars fall into that high category of the 22% that Jennifer was talking about. Adams County Senior Hub, Arapahoe County Human Services, Douglas County Human Services, all of these programs we fund will receive cuts in this if sequestration goes through like we think it will. So we'll have some hard decisions to make in the near future, and we have to understand, like Jennifer said, these cuts make no sense, because the goal of sequestration is to reduce government spending, right? And when people have to go on more expensive programs like through Medicaid and Medicare, or have to spend down until they're impoverished to get services, it ends up costing the government and us as taxpayers much more in the long run. And it's not that long. There are studies that have been done that about 25% or 23% of people who lose these services go on government programs within 6 months. So that's pretty quick turnaround. We also talked about the Boomer Bond. Remember, this is our Livable Communities, Lifelong Communities Initiative. We have the second version of our community assessment tool. You may remember that 3 of the communities, Lyons, Lakewood, and Wheat Ridge, went through the first iteration of the community assessment tool. This is a tool to help local governments understand, are you ready for the aging of your population? Do you have the services and the infrastructure? Have you thought about things that will help prepare you for this demographic shift, this unprecedented demographic shift? Based on their feedback, we made some tweaks and changes to the assessment tool, and we have 4 more communities that are interested in going through the second version, and we'll start doing that very soon. We're also developing a toolkit for local governments. So once you go through this, right, this assessment that's comprehensive, and then you say, okay, I've figured out where our gaps are, and I've figured out what our strengths are, and I figured out what the low-hanging fruit is, now what? So we're hoping to have a toolkit for you all to of best practices, model codes, resources so that you don't have to reinvent the wheel, and that you can consult when you're making those important decisions in your area. Also, I want to remind you that we have 3 openings for board members on the Aging Advisory Committee, and I would love it if any of you would want to join our meetings. They're the 3rd Friday of every month. We provide you lunch. Mayor Penn and Mayor Noon are on our committee. You want to say anything? Oh,
prepared for the senior issues that are coming up, and I think all of us need to make sure that we're very well versed in what's coming forward soon.
And actually, I have been, sorry for this voice, I've done it, I don't know, like 8 years. I actually don't represent the board there. I represent Arapahoe County, so I'm actually a designee, so I don't even take a board slot, so you get an extra board person, so there's extra there. So join Randy and I, please. We're going to miss Cliff. Cliff's been there forever, so that's a huge loss for our group. So join us.
If you're interested, give us a call. Thanks.
Thank you, Jayla. I would just add that one of the more interesting pieces to our trip last spring back to do some lobbying was a discussion with a staff member who indicated that although he agreed that it would cost 100 times as much to have to put someone into a facility because we had reduced Meals on Wheels or mobility to get them to dialysis, the 100 times as much came out of Medicare, which was a mandatory program, and the cuts came out of the Older Americans Act, which was a social voluntary program, and budget rules were that you couldn't compare the two. So I thought of Bill Maher right away and said, time for new rules. All right, so next is our report on the RAC from, I don't know if it's going to be Joyce, Joyce, okay?
Yeah. The last RAC meeting was September 6th, 2013. Our next one's December 13th. So of the September meeting, we had presentation of the 2012 audited financial statements. We had a report on new governor's executive order designating the RAC as the lead ozone planning agency for the North Front Range. We had a report on the 2013 ozone season, including an update on EPA ozone standard implementation. We had an update on status of Air Quality Control Commission's oil and gas regulation development process. We had a proposal for the Colorado Natural Gas Vehicle Implementation Plan and the RAC's role. We had an update on Charge Ahead Colorado, the status of the electric vehicle and charging station grants. A report of the Front Range Air Quality Study, and a report from Kate Cook on Every Trip Counts program.
Thank you, Joyce. Next is a report on the MetroVision Implementation Task Force. Flo Ritano.
Thank you, Madam Chair. Good evening. I am here as a very humble substitute for the esteemed Jim Taylor, who is the chair of the Implementation Task Force and who is spending some quality time in China. The Implementation Task Force met on November 6th, and the single item of business to conduct was to review and have a discussion with EPS on the housing diversity study that was released in very late October. The board was sent a link to that study, and that's still available on the Dr. Cog website. Would like to recognize the members of that committee for very substantial service and input into the process and the discussion. Kent Bagley, who was a board member from RTD, Joe Blake, Chancellor Emeritus of CSU, Max Bryant, who is the Executive Vice President and Branch Manager from First Bank, Tony Gagliardi, who is the Colorado State Director for NFIB, Joni Inman with Joni Inman Consultant, Robin Kanish, council member from Denver, Tim Mock, who is probably the only committee member who is here tonight, Commissioner from Clear Creek County, Ed Peterson, Transportation Commissioner, Wayne Reed from Centennial, Colorado, George Thorne, President and founder of Mile High Development, and Brian Voigt, the CEO of Denver Botanic Gardens. These individuals gave a lot of time and energy in focusing the work of the implementation task force. You will recall that there were two other issues that the task force had identified of interest to the board, and that included the coordination of land use and economic development, and the second one was the transportation station tackling the last mile challenges. I believe the last time the board considered this was in May 2012 and made the recommendation to move forward with those issues. And in the meantime, there is a lot of activity that has occurred within Dr. Cog, not the least of which is the SCI project that is really looking at economic development as a significant issue in MetroVision 2040, and then the MetroVision 2040 update itself. But as part of the work that is ongoing with SCI, there is a lot of the last mile discussions also occurring on the corridor working groups and with the corridor stakeholder groups. So really both of those issues are already in play in different programs of Dr. Cog. So when Jim gets back, it is the intention for us to have a conversation with the chair about the actual future of the implementation task force, and to perhaps consider the option of maybe they have met their objectives and time for us to send them congratulations and thanks very much for all of their efforts. But we will not make that as a recommendation to the board until our esteemed chairman Jim Taylor returns from China. I'd be happy to answer any questions.
Any questions? Thank you very much.
Thank you, Madam Chair.
Next is the report on the E470 Authority, and Mayor Rakowski isn't here this evening, but Jim, did you want to give that report?
Sure, I can say a few things. You know, we get requests from various special interest groups for wanting to get a free toll on E470. E470 is not taxpayer supported. It gets about 6% of its income from a $10 fee on your vehicle registration, about $9 million out of $160 million altogether. It's going to be about $160 million this year. It'd be the best year ever for E470. But we can't give breaks to special interests, I guess, because we have bonds to pay. We have $1,600 million in debt to pay off. So we're very. We did discuss doing it for Medal of Honor winners. You won the Medal of Honor, you can travel on E470 for free, I believe, if you're still alive. But there's been talk about, because E470 has some money, there's talk that some other state agencies might want to take it over. I'm not sure. But I think we've taken the steps necessary to insulate E470 from that kind of a practice. And that's about it from what I can remember, because I didn't know I was going to have to give a report, so I didn't bring the agenda with me, but those are some important things that happened.
Thank you, Jim. Sorry to spring that on you at the last minute.
I'm there. I don't mind.
Okay. Our last report is on fast tracks, and that's from Bill Van Meter.
Thank you. Do a few quick hits on some of our key projects that are going on fast tracks. On the Eagle project, we're over 50% done, and 23 of 36 miles of that total project are under construction. North Metro, Val Vigil and Jack Hilbert kind of stole some of the thunder, as did the press. Our board of directors has, as the Fast Tracks Monitoring Committee, made a recommendation to our full board that they approve the staff recommendation to select GBBH contractors to construct the North Metro Corridor from Denver Union Station to 124th. That action goes before our Board of Directors next Tuesday evening, and it was forwarded to the full board on a 14-to-1 vote. So I anticipate that it will pass at that point, and that we will be able to move forward in December with award of the contract and start seeing a groundbreaking in construction next year. On the I-225 corridor, I kind of think the key highlight, we're making good progress, particularly with Aurora, on the realignment that was part of the action earlier this evening from Montview to the Fitzsimmons Parkway. We've come to a basic agreement on what that alignment will look like and where the station, the relocated station, will be. And in fact, we have a public meeting scheduled on December 4th at 6 p.m. at the North Middle School in Aurora. Public meeting on that recommendation. Just a few more items quickly, trying to fly high and hit some of the key things. We've decided the date for the Denver Union Station grand opening, and that will be on the weekend of May 9th. That's when we will be having our grand opening of Denver Union Station, and so that will also mark the closure of Market Street Station, the move of bus operations to Denver Union Station that weekend. More to come in terms of what that will look like. And that's a partnership that, of course, includes Dr. Coggs, CDOT, and City and County of Denver, both on the DUSPA board and as part of that celebration. Whew, glad I remembered to give credit where it's due on that one. Two more items of note, and I'll wrap up. One is that on the US 36 corridor, the BRT corridor, we're making great progress in coordination with CDOT, who's leading the express lanes construction. Phase 1 is over 50% complete, and Phase 2 is looking good. And finally, the Northwest Area Mobility Study is also progressing well. 3 highlights there. Our board approved in September the remaining bus rapid transit funding priorities for US 36. We're working through vehicle selection and other items on that project. We released last month, I believe it was, early in October, the Northwest Rail and the North Metro extension to Longmont cost and ridership information. No decisions, no recommendations, information. And we're currently really working hard on refining the arterial BRT alternatives, primarily in Boulder County, as part of the NAM study. That kind of concludes my attempt at highlighting the key projects and studies going on at Fast Tracks.
Thank you, Bill. I would point out to board members that there's some informational items attached. Attachment M is a draft policy on state legislative issues. Attachment N is are the draft minutes of the October 16th, 2013 admin committee meeting. Attachment O is a draft summary of the November 6th MBIC meeting. And attachment P is relevant clippings and other communications of interest. If you have questions on any of those, you can contact staff. And then administrative items, our next meeting is December 18th. And I would open it up to any other matters by members.
Madam Chair.
Mayor Tisdale.
If I may, one point on the draft 2014 policy statement on state legislative issues, because I also serve as chair of the policy committee for the CML. I'm always interested in that, and I do note that there is a deadline that people should be aware of December 6th that staff has requested that comments and proposed changes be submitted to staff so that we can have them in our December board packet for the December meeting.
Thank you. Okay, any other, oh, oops, sorry, Joyce, and then Joe.
I just, I want to make sure that Sharon knows that all the work that she's put in here at Dr. Cog, we have to replace her on council at many meetings, and those are going to be hard shoes to fill. I just want to give her that recognition and let her know thanks.
Thank you, Joyce. Joe?
So in attachment P, there's a clipping about Netherlands' last election. We voted and it passed for the EcoPass for the entire Netherlands community. I just wanted to thank Dr. Cog, because that wouldn't have been possible if there wasn't that little bit of funding to do the pilot program in Netherlands. We really appreciate it. It's really the way it should work, and we're happy with the outcome. So thank you.
Thank you, Joe. Any other comments? Sorry, Randy?
We're so far ahead, I think I have about a half hour to go, so we can get going. So. Sorry. This doesn't pertain to Dr. Cog, but it's an exciting thing for Southwest Metro area, Littleton, Sheridan, Columbine Valley, and Inglewood. I got a chance to testify today at the Colorado Water Conservative Board. They have approved our project from C470 on Platte River all the way down to the Dartmouth crossing in Inglewood. There will be almost 7.5 miles of new trails, new waterways, and hopefully cleaner water coming down the Platte River. So we're excited. I know it doesn't, other than the trails, pedestrian and bikes, doesn't pertain, but we are excited and can't wait. Phil, get working on this now.
Okay, thank you very much. Anything else? Sorry, Cliff?
I just wanted to say that this last 10 years have been a real pleasure being here and meeting the wonderful people that really make the decisions that impact most of our citizens. And thank you.
Thank you.
Thank you, Cliff, and we appreciate your service. Anything else? If not, the meeting is adjourned. Thank you all very much.